When people share health information with AI, they're disclosing some of their most sensitive personal data. Many users approach this with a sense of anonymity and expectation of non-judgment. Unlike telling a doctor who knows your identity and whose reaction you can see, telling AI feels private and neutral. This perceived safety encourages people to disclose symptoms they might be embarrassed to discuss with human providers, sexual health concerns, mental health symptoms, substance use, stigmatized conditions. The lack of visible judgment can be therapeutically valuable, allowing people to seek information they wouldn't otherwise access. However, the reality of data handling creates significant privacy risks. What happens to health information shared with AI? Corporate policies vary widely. Some systems log all conversations for quality improvement or model training. Others claim not to store data permanently, but may retain it temporarily. Users typically accept terms of service without reading them, unaware of how their data will be used. There's potential for health information to be associated with user accounts, tracked across sessions, or even sold to third parties, depending on the platform and its policies. Consent mechanics are crucial, but often poorly implemented. When you start using an AI health tool, do you receive clear, understandable information about data practices? Are you asked to explicitly opt in to having your conversations logged? Can you easily opt out of having your data used for model training or analytics? Most current systems bury this information in lengthy legal documents that nobody reads. True informed consent requires clear, prominent, accessible explanations of data practices before people share sensitive health information. Regulatory oversight of AI health data is currently inadequate. HIPAA, the primary U.S. health privacy law, typically doesn't apply to consumer AI tools because they're not considered covered entities under the law. This means most AI platforms have no legal obligation to protect health information in the same way that hospitals and doctors do. Users may assume their health information shared with AI has the same privacy protections as information shared with their doctor, but this assumption is often false. There's an urgent need for regulatory frameworks that extend privacy protections to health data shared with AI platforms. The implications are serious. Health information could potentially be used in ways users don't anticipate or desire. It could affect insurance eligibility or pricing if insurers gain access. It could be subpoenaed in legal proceedings. It could be breached in cyber attacks. It could be used to build profiles for targeted advertising. Someone who asked AI about symptoms of depression might later be targeted with ads for mental health services, or worse, face discrimination if that information becomes accessible to employers or insurers. Solutions require multiple approaches. Platforms offering health-related AI should be required to provide clear, accessible privacy notices specifically about health data before any health information is shared. Users should have granular control over data retention and use, with easy opt-out options. There should be legal protections extending HIPAA-like requirements to health data shared with AI platforms. Independent audits should verify that platforms are following stated data practices. There should be significant penalties for mishandling health data to create real accountability. Users also need education about privacy risks. Many people don't realize that health information shared with AI may not be private. Public health campaigns should explain how to protect health privacy when using AI tools, being vague about identifying details, using browsers' private modes, understanding platform policies before sharing sensitive information. The goal isn't to prevent people from using AI tools entirely, as they clearly provide value, but to ensure people can make informed decisions about privacy trade-offs when deciding what information to share and which platforms to trust.